Assalamu alaikum. The last vitamin in the list of water soluble vitamin is vitamin C, which can also be known as ascorbic acid. We will discuss chemistry, chemical structure, occurrence, absorption, and metabolism, along with the role of vitamin C in biological system, its deficiency associated symptom, its hypervitaminosis associated symptom, and the causes of deficiency with daily allowance. Let's start with the occurrence and chemical structure. This vitamin is abundantly found in many natural resources, including fresh fruits, vegetables. The richest source of ascorbic acid, including Indian gooseberry, citrus fruits such as limes, oranges, lemon, tomato, potato, papaya, green and red pepper, kiwi fruit, strawberries, cantaloupes, green leafy vegetables such as broccoli, fortified cereal and its juices are also the rich source of vitamin C. The vitamin C, chemically referred to as L-enantiomer of ascorbic acid, or we can say that it is the L-isomeric form of ascorbic acid. And its oxidized forms are dihydroascorbate, and both are active. The later form can reduce and reform vitamin C, which is L-isomeric form of ascorbic acid. The D-isomeric form is inactive. Ascorbic acid is a weak sugar acid structurally and not the vitamin for many animals because it can synthesize in vivo from glucose. Man and higher animal, for example guinea pigs, bats, birds, fishes, cannot form vitamin C in their body due to the lack of enzyme L-gluconolactone oxidase, which catalyze the conversion of L-glucono-gamma-lactone to ascorbic acid. In the body, it is converted into two intermediate. One is dihydroascorbic acid and second one is diketogluconic acid. The ascorbic acid and dihydroascorbic acid are interchangeable form, so therefore they are both active, while diketogluconic acid is not the active form of vitamin C. So once it is synthesized, it will be eliminated as such in diketogluconic acid form or can be converted into oxalic acid. Now come to absorption of vitamin C. The intestinal absorption of vitamin C is regulated by at least one specific dose-dependent active transporter. Cells accumulate vitamin C via a second specific transport protein. In vitro studies have found that oxidized vitamin C or dihydroascorbic acid enters cells via some facilitated glucose transporter and is then reduced internally to ascorbic acid. The physiological importance of dihydroascorbic acid uptake and its contribution to overall vitamin C economy is unknown. Approximately 70 to 90% of vitamin C is absorbed at moderate intake of 30 to 180 mg per day. However, at the doses greater than 1 gram per day, which is the maximum dose, absorption failed to less than 50%. Metabolized ascorbic acid is eliminated in the urine as well as in the form of its derivative dihydro and diketogluconic acid, which gives oxalic acid. Now come to biochemical role. Vitamin C involved in the conversion of proline, which is present in the collagen, to hydroxyproline. In the absence of vitamin C, collagen cannot form and hence the normal tissue structure is failed to form. Second important role that it is acting as an antioxidant along with several other antioxidants including vitamin E, A already discussed and glutathione. As an antioxidant, it prevents oxidative injury which is caused by reactive oxygen species. High doses claim to prevent cancer, coronary artery disease. In cancer, its prevention is it is thought that it is occurring as an anti-cancer agent by preventing the conversion of nitrites and the secondary amine to carcinogenic nitrosamine. The third important function is that it is involved in steroidal hormone synthesis, which is known as steroidogenesis, and present in large amount in these glandular hormones. So if the person has taken ACTH injection or in a stressful condition, it is seen that utilization of vitamin C is very fast and its store in the glandular tissue can be depleted. It helps in reducing Fe plus 3 to Fe plus 2 to help in its absorption, which is useful to synthesize hemoglobin. So it is useful in the treatment of methemoglobinemia, which has an iron in the form of ferrous. It is also involved in degradation of amino acid tyrosine. Vitamin C involves in reduction of vitamin B9, that is folic acid, into tetrahydrofolic acid, which we have already discussed is one of the proactive form of folic acid. It is necessary step for the conversion of folic acid into tetrahydrofolic acid. So by forming tetrahydrofolic acid, it can be act as an one carbon carrier coenzyme. The deficiency of vitamin C can result megaloblastic anemia in infant due to non-utilization of folic acid. It is also involved in the processing of certain polypeptide like oxytocin ADH. It is also involved in hydroxylation of dopamine to noradrenaline, synthesis of carnitine, and bile formation. So all these are very important functions and role of vitamin C, that is protein synthesis, antioxidant activity, immune regulation, iron absorption, bile acid synthesis, serotonin production, which is related with the well-being and happiness, reducing activity in other situation, adrenal steroid synthesis. If we talk about daily recommended allowance for the male, it is about 45 to 90 milligram per day. If you recall, we have already discussed that the daily recommended allowance is related with the age or distributed according to the age. For infant, children according to their age, and adult according to their age, they need different value and different amount of different vitamins. In case of vitamin C, male requirement is 45 to 90 milligram per day, while for the female adult 45 to 75 milligram per day, while the allowance is incremented during pregnancy and lactation into 80 to 85 and 115 to 120 milligram per day respectively. Now come to metabolism of vitamin C. Once it is performing its action and its function in the body as an antioxidant, it is metabolized in the liver and at some extent in the kidney by the series of reactions. The principal pathway of ascorbic acid metabolism involves the loss of 2 electrons. The intermediate free radical reversibly form dehydroascorbic acid and leading to irreversible formation of physiologically inactive form, that is 2,3-diketogluconic acid. Diketogluconic acid may be either cleaved to oxalic acid and threonine acid and decarboxylated to carbon dioxide, xylose and xylulose, leading eventually to xylonic acid and lysonic acid. All these metabolites and as such ascorbic acid can be eliminated in the urine. Now come to deficiency, hypervitaminosis, and causes of deficiency. If we talk about deficiency of vitamin C, can result different type of illness as it has a major role in as an antioxidant in different type of reaction. For example, it is mainly involved in the synthesis of collagen required reaction, that is conversion of proline into hydroxyproline. So the main deficiency sign arise and termed as scurvy, that is the bleeding from the gums and inflammation of the smooth muscles. So scurvy is caused by a dietary deficiency of vitamin C. The other problems that can arise because of its involvement in the different metabolic reaction and biochemical reaction leading to cause anemia. Tooth and bone development is also impaired because it is involved in the formation of calcification of bone as well as to synthesize enamel at the tooth. Wound healing is also impaired because of its role in the development of a structural protein. The body's pool of vitamin C can be depleted in 1 to 3 months. So once it is taken in excessive amount, it can store for at least 3 months. There are certain risk factors that can be leading to cause deficiency of vitamin C. Like all other vitamin, if there is malabsorption or improper synthesis or improper conversion, that can lead to cause deficiency of vitamin C. If there is any disease which is associated with GI tract where the absorption is taking place, the deficiency can arise. Another important reason is the absence of certain transporter, which is an inherited disorder which can transport vitamin C into the lumen and into the different part of the body. These transport protein play a major role. It is thought that cow milk is a poor source of vitamin C as compared to the human milk. So babies who are fed on cow's milk during the first year of their life, they are at the risk of deficiency due to poor source. Cigarette smokers require increased intake of vitamin C because of the lower vitamin C absorption and increased catabolism in the cigarette smokers due to nicotine. The people with anorexia nervosa or anorexia from the other disease such as AIDS and cancer are at increased risk of vitamin C deficiency because of the excessive utilization. As far as dietary toxicity is concerned, the National Academy of Science has established a tolerable upper intake level, that is about 2000 milligram or 2 gram per day for the adult. So as it is discussed in the previous slides, that excessive amount once taken, it can be eliminated 50% as such, while only less than 50% absorption can take place. So therefore, the upper tolerable amount cannot produce any harmful effect, but it can store the amount of vitamin C in the tissue, specifically in the liver. While it is plausible that in rare situations, particularly with a rich intake of citrus juices, an individual could be above this upper tolerable intake from food alone. The most common side effects which are associated with the high doses are directly related with the GIT, stomach, and causing diarrhea. The other gastrointestinal symptoms that can arise once it is taken in the high doses, including abdominal cramp, headache, heartburn, and vomiting. So this is all about vitamin C, and I hope that will help you to understand the main role of vitamin C in the different mechanism and the different reactions in the human body. Thank you so much.